When you are in the clinic, when you are a clinician, I think there are plenty of work, and I think it's a tough environment that clinicians are in today. I think we as a manufacturer of medicine, we can help out in this context by making sure that we provide, for example, pen treatment, pen systems that are easy to teach, so that doctors don't have to spend so much time educating patients how to use them, for example. Another way is providing doctors with easy accessible data, enabling doctors always to prioritize in terms of treatment and what treatment to go for and so on. I think we can help there by reducing the time that the doctor needs to use in order to treat patients in the right way. I think that the greatest contributions that Novo Nordisk has made to children with growth disorders through the years has been, first of all, we were among the very first in the world to provide growth hormone. It dates back all the way to 1973. Subsequently, we were among the very first in the world to introduce genetically engineered growth hormone, meaning that now there would be plenty of growth hormone and enough growth hormone for everybody in the world to be treated. Novo Nordisk is proud to provide an array of service items to healthcare professionals in terms of education, in terms of training, in terms of symposiums and seminars, and also in terms of a number of grants for PhDs, for doctors, and for research, clinical as well as basic research. And we do that all over the world. Growth disorders are rare disorders, and therefore it is sometimes difficult on a clinic basis to compare data from one patient to another because patients are few and far between. When we make an ordinate system, we enable doctors all over the world to put the data into one data system and thereby being able to extract data from a population from all over the world and thereby also extracting better practices in terms of what treatment works the best. So I think that is a major contribution that we are making to the treatment of children with growth disorders. In the near future, we're looking at expanding our indications. We are very excited about looking at SGA, and we are also right now looking at the Noonan syndrome for an indication for growth hormone. And that is some of the short-term exciting areas of research we're doing. We have to think about patients' daily life, and of course when you have to inject yourself with medicine, and when you have to do that as a child, or if you have to do it as a parent, then of course it is very important that this is done in such a way possible that you eliminate pain or you eliminate the worry of injection, both by parents and patients. And I think by combining our long-standing experience in Novo Nordisk with pen systems and our ability to formulate stable liquid growth hormone, combining those two, I think we have achieved that actually. And I am pleased to say also that the Novo Nordisk pen systems are the by far most preferred systems by all healthcare professionals in the world. I think right now, in the perhaps shorter term, one of the things that excites me a lot is that we are looking at developing growth hormones that you don't have to take every day, that you perhaps would have to take perhaps once a week, perhaps every 2 weeks, thereby enabling patients to comply better with the treatment. That is some of the, on the shorter term basis, more exciting issues, I think. When you're thinking about what could one dream of in one's lifetime, I hope I will live long, that of course would be to see a way where we wouldn't need to inject children with growth hormone. Finding a way whereby we could solve those problems in a nicer and better way. This would be sort of the dream of all time. Curing some of those disorders where growth hormone is used would be a phenomenal thing, or maybe to provide other types of treatment, be that gene-oriented treatment or perhaps even tablet form or other ways, would be a dream of mine in my lifetime.